Hey everyone, excited to kick off this deep dive. It's all about mobile clinics and the incredible work they're doing, particularly in rural Africa. We had some great source material to work with on this one, reports, case studies, even a whole podcast dedicated to the topic.
It seems like you've been really digging into this.
Definitely, it's a topic that's both fascinating and really important, and I think it speaks to a larger conversation about healthcare innovation and access.
Absolutely. And it's not just about the technology, it's about the human ingenuity, the commitment to reaching those who are often left behind.
Right, it's like necessity breeds innovation.
Mm-hmm.
And when you see the impact these mobile clinics are having, it's truly inspiring. One of the reports mentioned that after Cyclone Idai hit, Mozambique mobile clinics were able to reach something like 300,000 people.
Wow, that's incredible. A real testament to how these clinics can be deployed in emergency situations.
Right. But it's not just about crises. It's about addressing a much deeper need, a systemic lack of access to basic health care.
Exactly. I mean, the numbers are staggering. Over 600 million people across Africa lack access to basic health care every single day.
600 million people.
Mm.
That's almost unfathomable.
Yeah.
But what are the factors contributing to this massive healthcare gap? Is it simply a matter of distance?
Well, distance is definitely a major factor, no doubt. Many of these communities are miles away from the nearest health facility, sometimes days away, even on foot.
I can't even imagine having to walk for days just to see a doctor.
It's a reality for so many people, and
Yeah.
it highlights the incredible disparities that exist even on a global scale. But it's not just about distance. There's also the issue of inadequate infrastructure, lack of reliable transportation, limited resources.
Right, it's a complex web of challenges.
Yeah.
So how do mobile clinics fit into the solution? What are we talking about here?
Essentially, mobile clinics are fully equipped medical facilities on wheels. They're designed to navigate challenging terrain and bring a wide range of services directly to these isolated communities.
It's like bringing the hospital to the people. One of the case studies described a converted Land Cruiser, basically a mini hospital on wheels.
Exactly, and they're equipped to handle everything from basic checkups and vaccinations to more complex procedures and chronic disease management.
So it's a pretty comprehensive approach, not just a Band-Aid solution.
That's the key. It's about providing holistic care, meeting people where they are, and empowering them to take control of their health.
That makes sense. But I'm curious, what are some of the tangible benefits we see when these mobile clinics are successfully implemented? How are they actually making a difference in the lives of these communities?
Well, one of the most immediate impacts is reduced travel time for patients.
Okay, that's huge, especially
Okay.
when you're talking about people who might have to travel for days just to reach a clinic.
Exactly. It means quicker access to treatment, less disruption for families, and less strain on already limited resources.
And I imagine it must be more cost-effective as well, both for the individuals and for the healthcare system as a whole.
Absolutely. Mobile clinics help minimize expenses related to transportation, extended hospital stays, and delayed treatment. Plus, they emphasize preventative care and early detection, which can help avoid more serious health issues down the line.
So potentially saving lives and resources.
Yeah.
That's a win-win.
It is. And then there's another benefit that I think is really crucial but often gets overlooked.
I'm intrigued. What is it?
Trust. When people have consistent and reliable access to healthcare, they develop a stronger sense of trust in healthcare providers.
Oh, that makes sense. It builds a relationship.
Exactly. And that trust encourages them to seek help sooner rather than later, which can prevent small issues from becoming major problems.
It's like a positive feedback loop. Access leads to trust. Trust leads to better health outcomes.
Precisely. It's about building a foundation for a healthier community, one visit at a time. It's interesting to think about, the evolution of this whole concept, bringing essential services to the people. It's not entirely new, right? We've seen it with mobile libraries, blood donation drives.
Yeah, it's adapting that model to healthcare. But I think what's really exciting is how technology has kind of amplified the potential of mobile healthcare. It's no longer just about basic checkups. We're talking about bringing sophisticated diagnostics, even specialist consultations, to some of the most remote areas.
Exactly. Technology is a game changer. Advancements in diagnostics, telemedicine, portable equipment, it's really transforming what's possible in a mobile setting.
One of the reports highlighted the work of UNFPA, the United Nations Population Fund. They're using mobile clinics to reach women and girls with essential services, prenatal care, family planning, even support for survivors of gender-based violence.
UNFPA is doing incredible work. It's really addressing some of the most critical needs, especially in regions where women might face barriers to accessing traditional healthcare.
The report had some powerful images. Vans transformed into these havens of care, bringing hope and essential services to communities, especially in the wake of disasters like Cyclone.
It's a testament to human resilience and the power of innovation. And then you have organizations like Rescue Ride Africa. They're fully committed to scaling up mobile clinic programs across the continent.
I was impressed by their approach. They've partnered with Toyota to use those really durable vehicles, the Hi'Eis and Land Cruisers, which are perfect for navigating those tough terrains.
They're built to last, but it's more than just providing the vehicles, right? Rescue Ride Africa is investing in training local healthcare workers, ensuring that these programs can be run and managed by the communities themselves.
That's smart. Building local capacity is essential for long-term sustainability.
Absolutely. It's about empowerment, not just aid.
But I'm sure funding is a constant challenge, keeping those vehicles running, ensuring a steady supply of medications.
You're right, funding is always a hurdle. But there have been some promising developments. Did you see the article about the investment from DFC, the U.S. International Development Finance Corporation? They put $10 million into Africa Invest's Transform Health Fund.
Yes, that was great news. It's specifically targeted at strengthening healthcare services and supply chains in Africa. And they're focusing on supporting small and medium enterprises, those involved in medical device manufacturing and pharmaceutical supply.
It's a strategic approach investing in the entire ecosystem.
Exactly. It's not just about providing clinics, it's about creating a sustainable infrastructure.
Right. And it shows the potential of public-private partnerships, blended finance models to really make a difference.
So we've talked about the logistics, the organizations involved, but let's zoom out for a second. What are some of the larger ripple effects of these mobile clinics? How do they impact communities beyond just healthcare?
Well, it's about more than just treating illnesses. It's about uplifting entire communities. When people have access to healthcare, they're healthier, they're able to work, their children can go to school. It breaks the cycle of poverty, creates a brighter future.
It's an investment in human potential.
Exactly. And we see this play out in so many ways. There's a great example from a mobile clinic program in Kenya. They realized that transportation to the clinic on designated days was a major obstacle for people. So they organized a volunteer motorcycle taxi service to bring people to and from the clinic.
Wow, that's amazing. A community-driven solution to a very real problem.
It shows that these communities aren't just passive recipients of aid. They're active participants shaping solutions that fit their context.
It's inspiring, but it's also important to acknowledge that no solution is perfect. What are some of the challenges and complexities associated with mobile clinics that we might not immediately think about?
Funding is always going to be a challenge, of course. But there's also the issue of vehicle maintenance, especially in those rugged conditions, and finding qualified healthcare professionals who are willing to work in remote areas, providing them with ongoing training and support.
It's not a one-time fix. It requires ongoing commitment and investment.
And that's why community engagement is so vital. You need to involve communities in the design and implementation of these programs from the very beginning.
It's about collaboration, co-creation.
Exactly. It's a partnership, a shared journey towards better health. And that's what I find so inspiring about mobile clinics. They represent a shift from a top-down approach to healthcare to a more collaborative, empowering model.
It's about shifting the power dynamic, putting communities in the driver's seat.
Precisely recognizing that communities are the experts in their own needs and aspirations. Mobile clinics give them a platform, a voice, and the resources to take control of their own well-being.
It's been a fascinating conversation so far. We've explored the incredible potential of mobile clinics, the challenges they face, the ways communities are adapting and innovating. But what does this model tell us about the future of healthcare? Where do we go from here?
I think mobile clinics are a powerful example of how healthcare is evolving, moving beyond the confines of traditional hospitals and clinics. Technology is allowing us to bring care directly to people wherever they are.
We're breaking down barriers, both physical and societal.
Absolutely. And it requires a shift in mindset, a move away from a one-size-fits-all approach to something more adaptable, more responsive to the unique needs of each community.
It's about creating a healthcare system that's truly patient-centered.
Well said. And I think that's one of the key takeaways from the mobile clinic model. It's about humanizing healthcare, building trust, fostering relationships, and empowering individuals.
We've covered a lot of ground in this deep dive, but we've really only scratched the surface when it comes to the future of mobile clinics. There are some truly mind-blowing advancements on the horizon. Okay, you mentioned these mind-blowing advancements. What has you so excited about the future of mobile clinics?
Well, I think one of the most significant developments is going to be the integration of artificial intelligence, AI.
AI. That's interesting. How do you see that playing out in this context?
AI algorithms can analyze huge amounts of data, right? And that can help healthcare professionals and mobile clinics make quicker, more accurate diagnoses, even in areas with limited connectivity.
So we're talking about bringing the power of AI to some of the most remote and underserved communities in the world.
Exactly. Imagine a mobile clinic equipped with an AI-powered diagnostic tool. This tool could analyze a patient's symptoms, medical history, environmental factors to help identify potential health issues.
It's like having a team of specialists right there in the mobile clinic, even if they're thousands of miles away.
That's the idea. It's particularly valuable in areas where access to specialist care is limited. AI can help bridge that gap by providing healthcare workers with the information they need to make informed decisions.
That's fascinating. So AI is one piece of the puzzle. What other technological advancements are you seeing in this field?
Well, we're also seeing some incredible progress in portable medical devices. Ultrasound machines, for example, are becoming smaller, more affordable, and more user-friendly.
I remember reading about a pocket-sized ultrasound device that connects to a smartphone.
It's incredible how technology is shrinking these once bulky and expensive machines, right?
Right.
These portable devices mean mobile clinics can offer a wider range of diagnostic services from prenatal care to cardiac monitoring right there in the community.
It's really expanding the scope of what's possible.
Yeah.
And then there's the whole realm of telemedicine. How is that being utilized in mobile clinics?
Telemedicine is becoming increasingly essential. With a stable internet connection, a mobile clinic can basically become a virtual portal to specialists located anywhere in the world.
So a patient in a remote village could have a real-time consultation with a specialist in a major city, just through a video call.
Exactly. It's breaking down geographical barriers.
Yeah.
And it's not just for consultations. Telemedicine can also be used for remote monitoring of patients with chronic conditions, which is a game changer for ongoing care in areas where follow-up appointments are often difficult.
So someone with diabetes, for instance, could use a mobile device to track their blood sugar levels, and that data could be transmitted directly to their doctor.
Right. It allows for much closer monitoring, timely adjustments to medication, and early intervention when needed. It's really transforming how we manage chronic illnesses in remote settings.
It's amazing to think about the possibilities. But of course, with any new technology, there are always challenges and ethical considerations, especially when it comes to something like AI or telemedicine. What are some of the things we need to be mindful of?
Data privacy is paramount. We need to ensure that patient information is handled securely and responsibly, particularly when transmitting sensitive data over long distances.
And there's also the issue of digital literacy and access. Not everyone has equal access to technology or the skills to navigate these advancements.
That's a crucial point. Bridging the digital divide is essential to ensure that everyone can benefit from these technological leaps, regardless of their location or socioeconomic background.
So it's not just about equipping clinics with fancy technology, it's about empowering communities with the knowledge and resources to use these tools effectively.
It's about a holistic approach combining cutting-edge technology with community engagement and education.
Okay, so looking ahead, what's your vision for the future of mobile clinics? Where do you see this field heading in the next decade?
I envision a future where mobile clinics are seamlessly integrated into the broader healthcare ecosystem. They're not just standalone units, they're extensions of hospitals and health systems.
What do you mean by seamlessly integrated?
Imagine mobile clinics connected to a robust data network, sharing information in real time with hospitals and specialists. These clinics would be able to schedule appointments, order lab tests, even dispense medication, all while seamlessly updating the patient's electronic health record.
So it's not just about bringing healthcare to the people, it's about bringing the entire healthcare system to the people.
Exactly. And with advancements in AI and personalized medicine, we could even see mobile clinics offering tailored treatments based on an individual's genetic makeup and lifestyle.
Wow, that's incredible. It sounds like we're on the cusp of a major transformation in healthcare delivery.
I believe we are. And it's important to acknowledge the pioneers organizations like UNFPA and Rescue Right Africa. They're paving the way for this future. They're not just delivering healthcare services, they're pushing boundaries, advocating for change, and showing what's possible.
It's truly inspiring work. And it reminds us that healthcare is not just about technology and infrastructure. It's about human connection, empathy, and a deep commitment to ensuring that everyone has the opportunity to live a healthy life.
It's been a great conversation. I hope you're leaving with a sense of hope and excitement for the future of mobile clinics. It's a field that's full of innovation and the potential to transform healthcare for generations to come.
I know I am. And for anyone listening who wants to learn more, we'll include links to the reports and organizations we discussed in the show notes. Thanks for joining us on this deep dive into the world of mobile clinics.